Is there an eye drop that can brighten the white of the eyes in 1 minute? In today's eye health video, we will take a closer look at the cosmetic eye whitening eye drop called Lumify by Bausch & Lomb. Stick around. Hi, I'm Dr. Jennifer Wan, the optometrist of Ardent Vision Eye Care in Richmond Hill, Ontario. As of July 2022, a new eye drop by the trade name Lumify hit the shelves of major pharmacy retailers in Canada. This same eye drop has been available since 2017 in the United States and has already caused quite a buzz. For those of you who haven't heard about it yet, Lumify is an over-the-counter eye drop that can help the white of the eyes turn from pink or red to significantly whiter in 1 minute. But wait, you say, there's already eye drops that can do that. The most well-known ones being Visine for red eyes and Clear Eyes. While these blood vessel constricting eye drops can give whiter eyes very quickly, people are also learning about the pitfalls of traditional vasoconstricting eye drops. Pitfall number 1 is something called tachyphylaxis, which is a big word for the loss of effectiveness of a drug with continued use. In other words, if you're using the drops frequently, you may find yourself needing more and more drops to sustain the desired eye whitening effect. Pitfall number 2 is rebound redness effect. It describes a phenomenon when one stops using the drops that their eyes may be more red than they were before using the drops. Lumify differentiates itself from other over-the-counter vasoconstricting eye drops in that it uses the main active ingredient of 0.025% brimonidine tartrate, while traditional vasoconstricting eye drops use agents that constrict both the arteries and veins on the eye. Lumify primarily acts to constrict the veins only. To understand the significance of this, you just have to understand that arteries are primarily for bringing oxygen to our tissues, and veins are for carrying deoxygenated blood away. With the use of traditional vasoconstricting eye drops, the arteries will constrict on the eye, therefore leading to low access of oxygen to the eye while the drops are used. When the drug effect wears off, the eye will likely dilate its arteries to feed itself of oxygen that it's been lacking. When the Lumify eye drops only constricts the veins, it essentially allows the arteries to still bring a healthy amount of oxygen to the eye. This is why there's less chance of a rebound redness effect. Furthermore, in clinical studies, brimonidine or Lumify shows no evidence of losing its effectiveness with use over time. At this point, you might say, we have a miracle eye drop then. Having said that, I do think it's equally important to understand the risks of using Lumify before determining if it's right for you. Lumify is for eye redness that is caused by minor irritations with no apparent underlying disease or pathology. The immediate question that comes to your mind might be, how can I tell what my red eyes are due to? And you are exactly right. Personally, this is the greatest danger I see with over-the-counter vasoconstricting eye drops. The average person may use it as a quick fix to perhaps bigger problems that actually need medical attention. For this reason, I would highly recommend anyone with a red eye to visit their eye doctor first. It is only after the eye doctor rules out ocular pathologies for causing the eye redness would one be a good candidate for trying Lumify. A study of over 600 subjects was conducted to assess the adverse risks of using Lumify. The following chart is a summary of the findings. An important metric to understand the safety of a drug is something called TEAE. It stands for Treatment Emergent Adverse Events. These are undesirable events not present prior to medical treatment, or an already present event that worsens either in intensity or frequency following the treatment. In the study, 426 healthy subjects with eye redness used Lumify 4 times a day for anywhere between 5 to 28 days. As a comparison group, 209 similar subjects used the same drops but without the active ingredient of brimonidine. With these two comparison study groups, we can then see if brimonidine will cause any additional risk or side effects to its users. The good news is, it seems like the active ingredient of brimonidine does not cause any significant increase of risk of adverse events when compared to the same eye drop without it. The bad news is, roughly 1 out of 5 users of the Lumify eye drop will come across some kind of adverse event, with the most common ones being blurrier vision and overall increased eye redness. So what is causing the high risk of adverse events, even in the group using the eye drop without the active ingredient of brimonidine? My best guess would be the preservative used in Lumify, which is benzalkonium chloride, or BAK for short. BAK has been widely used as an antimicrobial preservative for pharmaceutical products, including eye drops. But it is a known fact that BAK can cause sensitivity, especially to those with existing asthma or skin conditions such as eczema, especially when used in higher doses. So here's my personal take on the Lumify eye drops. Lumify is my over-the-counter eye drop of choice for temporarily improving eye redness that is not due to an infection or an allergy or even dryness. Given the relatively high risk of adverse events with the prolonged use of Lumify eye drops, I would advise using the drops only occasionally for special events rather than incorporating it into your daily routine. Because there is a chance you may be masking a bigger underlying eye problem, please consult your eye doctor before using any over-the-counter vasoconstricting eye drops. Speaking of which, if you would like to book an eye exam with me in the Greater Toronto area, make sure to find my contact information in the description box below. If you learned something from today's video, please hit the like button to show your support. Subscribe if you enjoy watching free eye health videos like this. Hit the notification bell so you won't miss the next one. Thanks for watching. Bye! 哇，你睇呢條尾巴咁樣擺嘅，真知道。